How are you?
Hey, I'm good.
So we've known each other probably a little less than a year now.
Correct.
I've learned about your mission, which is crazy because it's right here in our backyard, and
Yeah.
I had no clue. I had no idea about it. So
Well, a lot of people say.
and yeah, that's been exciting, just kind of learning everything that you guys do. But before we get into that, let's take it back to kind of how you got into what you do, and
Okay.
kind of just the start of your work in this nonprofit field and all things like that, if you want to.
Yeah. It was kind of wild. I started working in a nursing home when I was 17. And the first day I came home from work, I told my mom, I'm not going to be a child psychologist anymore, which I'd already taken high school credits for that. And so I was like, I want to work with elderly. And
How
she
did
was-
you get how did that job come about?
Just when I was in high school, a friend of mine worked as a nurse's aide, and she was
Okay.
like, hey, we're hiring. And I wasn't allowed to work in high school. My mom and dad were like, school's your job. You know, I was in dance, I babysat, but I didn't have a job. And so I just had, the opportunity to go to school, attended an extracurricular, and then right out of high school, it was like, time to get a job. And this girl was like, hey, we're hiring nurses' aides. No
Gotcha.
experience necessary. They'll train you, and they trained me. So did that and just loved it that very first day. And in Texas, that's where I was, they actually have what's called medication aides. So I became a certified nurse's aide, and then became a certified medication aide, which is right below a nurse. We couldn't give injections, you couldn't do like feeding tubes, but we could give medicines, eye drops, stuff like that. And you were then over a floor, like in a nursing facility.
Gotcha.
And so I was in nursing school, and that kind of was a perfect transition, but it was kind of wild because I graduated early. I had just turned 17. And so I was 19 years old giving controlled drugs and passing out liquor at happy hour. Some of our residents got to have a little glass of wine or whatever. And I'm only 19 years old doing all this. But it was very enlightening because I really saw, sadly, in the nursing industry, which is still true to this day, we've gone to a lot of electronical stuff, but there is so much charting and documentation that has to go into place. And I was like, I want to be with the resident. Like, I don't want all this paperwork, but you have to, And so I transitioned into what I thought was going to be occupational therapy school. And that brought me back here to Louisiana, to what was Northeast Louisiana, now ULM. And from there, I actually went into grad school and got my master's in gerontology, which was super amazing. God always has his hands in things. And I came back here because I really wanted to get back in touch with my father and my brother and sister. And so came back, got my master's, actually got my nursing home license. And then kind of the ironic thing I say, and you've been to my office and you see this because, I got out of nursing because of the paperwork, but like you don't even see my desk because of all the paperwork and stuff. But that got me into nursing homes. And when I was doing my grad school and stuff, I worked as social worker, I did admissions, all in nursing facilities and everything. Excuse me. But got my administrator's license and had the opportunity to actually build from the ground up Heritage Manor, Strathmore, and Shreveport. And that was in 2006, which was remarkable. Like literally we were putting beds together, and putting the tables together and, moving the artwork around and everything. And it's still I think one of the most beautiful facilities in our area. But I have a special needs son, and working in long-term care is hard. Being an administrator, you're really hands-on, things happen all hours of the day and night. And when my phone would ring, my son would go, Mama, leave. Mama, go work now. And I have a great supportive family, and my aunt saw that, and ironically, this job came open over here. She was at the doctor, and her doctor said, my mom's retiring from the Bossier Council on Aging. And I was doing work with Caddo Council on Aging because my facility was in Caddo. But every council on aging is different. So definitely if people hear this, like what we do at Bossier Council, there's councils on aging in every parish of Louisiana, but we're all a little bit different. But you're going to hear about different services, and those are all going on, but how they do them are a little bit different. So I was familiar with Caddo, and my aunt called me and she goes, you need to apply for this job. And I was like, I'm happy where I am. I'm making great money, I'm doing awesome. And she was like, no, you need to apply for this job. And about a week and a half later, she called me. It was my birthday, November 12th. And she says, Aunt Marty and I have been praying about it. I'm sending your resume in. I found one on my computer. And I was like, no, don't do that. That's an old resume. Like if I'm going to apply for something, I want my best foot forward,
Right.
So I was like, okay. So I applied for it, and that was in 2010. So, yeah.
So you're 15 years in.
15 years in at the Council on Aging, yeah.
Well, tell me about, like, I guess, especially just to educate everyone on what it is, everything you guys do, because it's a lot. And really, I think it's a good time to kind of let everyone know what all you do,
Yeah. So, like I said, every parish has a Council on Aging. In 1975, our legislation did some good stuff, and they said they wanted each parish to have a local contact for our seniors. They felt the importance in that. All across the nation, there's what's called area agencies on aging. It's like my mom lives in Houston or outside of Houston area in Pearland, and she can go to an area agency on aging, but it's like 4 counties over, okay? So there's nothing that's always local. So that's what Louisiana saw, that people need to not have to basically leave their parish, So that we've been around since 1975. We're actually celebrating our 50th year this year, June 16th to be exact, and we're going to talk about that later. We got some fun stuff coming up for that. So it started out with us in Bossier as just 3 homemakers. That was where we were serving people, was just going in and kind of helping people with a little bit of housekeeping, trying to help them keep their house tidy, livable, that kind of thing.
Well, how do those, you started just having those, so that's like you deploy them somewhere, right, to different houses or
Correct.
whatever. How do people qualify for these services?
Okay, so in order to qualify, the first thing is you got to live in Bossier Parish.
Right.
And that's with any council on aging. You live in the parish, okay?
Gotcha.
So again, this is Louisiana. Be 60 or older. That comes from the federal side. A lot of people say, well, I'm 52 and I'm disabled. For us, and the way our funding is under the Older Americans Act, that is 60 and older.
Gotcha.
And so those are the first 2 criteria. Then we have to do an assessment, and we look to see, what the person's needs are. We look at, and people in the medical field understand this, activities of daily living and independent activities of daily living. Activities of daily living are what you're walking, bathing, toileting, dressing, eating, feeding yourself. Your independent activities of daily living are the things like driving, shopping, money management, medication, light housework, heavy housework, those kind of things that, are outside of just your daily. So we do a full assessment. We also check to find out they're veterans, different things like that, because sometimes there's other things we can get people connected to they may not know about, especially here. We have a lot of veterans with Barksdale and everything. So we try to, we look at all that and everything. We do a small dementia screening. It's not, I am a certified dementia practitioner, but what we do is just a few little questions just to kind of gauge. Sometimes if my staff during that assessment goes, hey, there's something going on, they may refer them over to me to maybe talk with the family a little bit more, and I could look at some more testing and stuff like that. So the assessment comes, and then that allows us to determine their capability, and then we also look at, are you able to perform or have someone who can perform what you're asking for? And what that means is every service is a little bit different. For like homemaker, I had a client who lived with her family, but she's like, I don't want them having to come clean my room. She had like a little mother-in-law cottage.
Right.
And unfortunately, we weren't able to qualify for homemaker because you live with someone who can come do that. However, during the assessment, we go, but you live with someone, let's bring them in under the caregiver aspect because you're living with them, they help take care of you, and maybe we could then qualify you for some other supports and stuff. So that's why the assessment is so important, and we do that annually. So even once somebody gets an assessment done, we reassess every year. We are required to do that under the governor's office. That's actually who we work under, is the governor's office of elderly affairs, but we're not governmental. That's kind of one of those weird things. We're quasi-government.
Got you.
And so they monitor that. They come in, they do audits on us to make sure we're doing our assessments. Are we doing what we're supposed to do on that side of it? And then once someone has their assessment done and then they qualify, lots of times we can get them started pretty quickly. Sometimes we do have waiting lists depending on what our service allowances are and everything on stuff like that.
Okay. So how is it, like, what's the process? Like, the people, and most of the time, is it like the children of the elderly that reach out to you and say, hey, or is it Like,
It's a combo, really. And I'm going to say this, and if we have any of those people out there watching and listening that are in that sandwich generation of taking care of kids, maybe taking care of parents or whatever,
right.
Our seniors are sly, They don't always tell their kids a lot. And sometimes, they make it out like they don't need a lot of help or whatever, because having worked in nursing homes, I can say this, and I say this when I go to speak to our public officials and stuff. If you have kids, you kind of know, like you had your bag ready, you knew you were going to go to the hospital at some point, and you were packed, and hey, it's going to happen. No one has that bag packed ready to go to that nursing home.
Right.
No one wants that to happen, And so many seniors have that fear of, if they think I need help, they're going to think I need to go to a nursing home or whatever,
Yeah.
So, not to say we don't get those referrals from those kids, because there are kids who are very intuitive, they're very engaged, they're very knowing, and what we do is not to try to help put people in a nursing home. I was actually accused at one point when I left nursing home long-term care and came to the Council on Aging. They're like, "Oh, you're just anti-nursing home now," and I'm like, "No." Opposite. Like, we actually sometimes help families go, it's time.
Right.
Because
you may know and they don't.
Yeah. So a lot of our calls really actually come from neighbors,
okay.
churches.
Okay.
Sometimes people go, well, my doctor referred me. My doctor wrote an order. Well, we're not medical care. We're not home health. We're not hospice. We are voluntary services. People don't have to participate in us. And sometimes people don't want to participate. I've had oftentimes families will call and go, my dad needs this, and we call dad, and he goes, I don't want nobody in my house. Lose my number.
Well, that was going to be my next question. Is like, I could see where, if they wouldn't tell the kids, or also they may be too embarrassed or just, hey, I don't think I need that yet, so they may not reach out to you directly either.
Correct. And two, we still have this generation. We're aging, so some of our greatest generation is passing on. But we still have quite a few folks that they're the mentality of, there's someone who needs it worse than me.
Yep.
And we're like, but that doesn't matter with us. I mean, if you need it and you qualify, it's not going to take it away from somebody else. If there's someone else who is in that shape or that condition and stuff. So,
well, that generation's used to limited resources, right?
Exactly.
And so that mentality is kind of carried on.
And very trying to be very self-sufficient in things, So we try to educate in that, because everything we do, like even when we go out to some of our seniors, they're like, well, I don't know. This isn't, one, it's not insurance, so it's not billing your insurance. You can be on home health and get our services, because usually home health doesn't last that long. Usually that's intermittent. We're trying to, once you qualify, you're going to continue to qualify if the need is there. So we're there to help you stay independent. We're there to help that senior and that family keep them in the home and not possibly face institutional. But oftentimes, and my staff knows, like, if you have questions about nursing home or assisted living, we're getting you to Miss Crane. They'll refer them, hey, she can help you, navigate the system and stuff like that. I haven't worked at it in 15 years. However, I still stay connected. I still keep my CEs up and stuff. So try to do that. And plus, I do a lot of speaking engagements where I go speak to the social workers and the case managers for them to get their CEs and stuff for the state. So try to stay in touch with those things.
I got you. Well, sorry I took you off track, but when I think of something like, let me ask now, because I may forget it. Back to the services you provide, like every single one of those services, like we can map them out if you want.
So let's start with our senior centers, because that's kind of the fun thing. We do have 3 senior centers across Bossier Parish. We have our Bearcat, which is right, like you said, here in the backyard of East Bank on Bearcat Drive by Bossier High School. That's our main office, but it's also a senior center. Then we have Benton, which is right there in Town Square. And people go, I didn't know you had one in Benton. And I'm like, yeah, it's the mayor's office, the police department, the community center, which is us, and then the bank. So we're right there on Sibley, just up from the school board. And then in Houghton, we have one, and it is currently in the Mason Lodge, which is in the parking lot of First Baptist Houghton. So Benton and Houghton are open Monday through Thursday from 9 to 12. They start opening up about 8, getting everything ready. And they do different activities and, have lunch every day. Our Bearcat site is open 7:30 to 4 Monday through Thursday and 7:30 to 2:30 on Fridays. And it's the bigger location. That's where all of our admin is. But they all have the same service in the sense of activities of some kind, whether it be exercise, wellness programs. Speakers come in, whether it's a bank, a home health, just different things. LSU Ag Center, they'll come in and do presentations. Bearcat and Benton both have exercise rooms. Houghton doesn't because of the location we're in. They all three have beanbag baseball teams that they love. The Houghton Hoots are really competitive, and so we're going to a tournament this week actually. So today, they're Thursday. I know we're going to be airing this, but it is today. So the Houghton Hoots love going out to tournaments and stuff. But then, like I said, the admin offices are at the Bearcat site. So when a senior comes to the site, we always tell them their first visit is quote free. We're not going to bug you with a bunch of paperwork, just come in, try us out, see if you like it, get the calendar, you can see what we have going on, see what the lunch menu is. Lunch is usually really good. I know sometimes everything isn't for everyone, but yesterday I did sample the meal and it was red beans and rice with sausage and turnip greens, and it was great. I ate my whole plate. So, because sometimes our seniors say, well, it just didn't taste right. And our meals aren't cooked for a specialized diet, but they're meant to be able to be eaten by anyone. And so you can season it up, that kind of stuff like that. So we serve lunch every day, though, at Bearcat, Monday through Friday. The other 4 sites serve lunch Monday through Thursday. So that's the senior centers. And then for our home-based services, we start with transportation. So our transportation can be anything like getting you to a site, which if you live in a town of Bossier, Benton, or Houghton, we will pick you up and bring you to our site at no charge. If you need medical transportation, we offer that all across the parish. And that is for anybody that's elderly or disabled through Medicaid.
Gotcha.
So they would call their Medicaid provider. Medicaid pays for that. Our seniors, if they don't have Medicaid, they pay us, and it's only $5 a stop. So that's pretty efficient when you're thinking, I'm bringing you from plain dealing down here, and maybe you need to go to the doctor, then also stop at the pharmacy, and you're getting all that for $15.
Yeah.
And all of our vehicles are handicap accessible, whether it's our big bus that has a lift or our minivan just has a roll-in. All of them can handle wheelchairs, walkers, anything like that. So transportation, then also to the grocery store. So again, in the towns, we'll take you to the grocery store and get you the grocery shopping. We alternate and rotate different grocery stores. And then we also go to the base in Bossier City. So if you're a veteran that has access to the base, and I have to make sure I say that because when we first started it, we promoted, we're going to the base, and we had 2 people that just got on. And when we went to the gates, they got on to check everybody's IDs. And these 2 ladies were like, we don't have what? We just wanted to come to the base. And they're like, don't get off the bus. So we have to say, you have to have your own access to the base. So we want to try to support what Barksdale does here in our community and everything. So transportation is about helping those people get connected to those medical appointments, to the grocery store, to the senior centers, that kind of thing. And then, and they can even have somebody ride with them. I had a couple for a while that the husband was the primary driver, and the wife didn't, but then he had to have surgery that kind of made him unable to drive for a little while. So she's like, well, do I ride with him? I'm like, yeah, you ride with him, So we'd pick him up so he'd get to his appointments, and she rode along with him and everything. And then after about 10 weeks, he was able to be cleared for driving again. So then we go to our real home-based services, which are things like home-delivered meals, which a lot of people kind of go, it's Meals on Wheels. And that is true. Meals on Wheels is a part of what we do. It's an organization we're a part of, but our service is actually called Home Delivered Meals. And those are for clients who are homebound.
Okay.
They can't leave their home, whether it's with our transportation or they're outside of our ability to transport, and they're unable to cook or have someone who can cook for them. And we do that right now through Mom's Meals, which we really like this because before, our meals, again, like I said, not really dietary specific or anything. And I'm going to kind of quote my niece here. You kind of got what you got and you didn't throw a fit about it, And so, which wasn't always great because sometimes when we have our homebound clients, their medical needs may be a little different. So with Mom's Meals, our seniors get some empowerment. And that was another thing too that really resonated with me because when you have someone who's trying to be independent and remain at home and you're taking so many choices away and then they need a meal and here it is, you get this and you don't throw a fit. With Mom's Meals, they get to choose. They get a menu of like 40 items and they get to pick what they want.
Okay.
And then if they're on a specialized diet, we have one gentleman who's getting kosher,
Yeah.
We have 2 that are on puree diets right now because of where they are on the stage and what they need, they're on puree. So many variances in that. They can handle allergies, gluten-free, peanut. And then just the simple things of like a diabetic, you know. So, but the seniors get to choose that. There's a couple we had during COVID, because during COVID, we were like Oprah of meals. Everybody got a meal. And so I had a couple that he liked getting up in the morning, so he usually pretty much ordered all breakfast stuff. His wife didn't get up as early, so she ordered mostly dinner type stuff, you know, the entrees and stuff. But it worked out great for him, you know. It was a good little balance. So with Mom's Meals, how we have it set up right now is every senior gets 10 meals delivered every 2 weeks. They're not frozen because people are people of habit. And when you put stuff in a freezer, you don't open your freezer as often, okay? So they come to you cooled. And just like you would get like an Omaha steak box or a home chef, whatever. And so they can unpack them. If they want to freeze them, they can. But they can stay in the refrigerator for up to 14 days past the delivery. And then they can warm them up. Now, if they put them in the freezer, that's on them. But ideally, it would be keep them in the refrigerator so when you're opening it up, the food's right there ready for you and everything. And then they order their next meal the next week, and then it comes. It's just a nice little rotation. I'm going to do a little side note. We're hoping to get a blessing from Representative Cruz. He's working on something in legislation with us. And if we get it, we will actually be able to provide meals. Because with what we currently do, we provide 260 meals to seniors.
Okay.
For homebound. We're only required to do 250, so we're already doing 10 extra. But Representative Cruz called last week and asked for some ideas on some funding that may be available, one-time funding though. And so I presented him with the ability to do meals 365 days a year for our home delivery meal clients. So if we got that, we would certainly put that in place immediately and start doing meals for those clients. They would get 14 meals every delivery versus 10.
Right.
So, so fingers crossed that happens. Legislation.
And that's how many people are getting these? Like how many people are you servicing?
We're currently at right about 140 in the parish.
So 140 and how many meals are they getting? 10?
They get 10 every 2 weeks. So they get 260 a year.
Right. Mm-hmm. Okay.
Yeah. And then if we get this funding from him, it's one time, but it would allow us to go up to 365. And so we would be able to do a whole year at that point. And then hopefully my goal is I'm trying to work our budget where we can get to that anyways. So this would definitely give us that kickoff to be able to do that. So,
and how do they qualify for that service?
Again, the assessment.
But is this something that's paid for by them?
So clients can contribute. Thank you for asking that, DJ. So clients can contribute for services. However, it's not a requirement.
Okay.
So all the different services we're talking about, with the exception of those medical rides where I said it was $5 each stop.
Right.
Everything else is contribution based, meaning I kind of equate it to tithing, but I was at church the other day and I was like, I need to quit saying that because, God says we should tithe. But, our clients give what they can give,
gotcha.
When they can. Sometimes families will come in, and do that, and because they recognize the value in it and kind of the relief that we give to them. And I'm going to go into our caregiver service here in a second. But yeah, so it's not like if I bring a meal or that box shows up and you're not paying us, like we take the box back.
Right.
Now we're definitely trying to look at ways to make it easier for clients to give. We normally send a letter and they can send a mail back, a check. We are now looking at Zeffy and sending out a link because I told my staff, we need to quit thinking our seniors are not technology savvy. And
they can get on Facebook.
Yes, they can. And we're actually even working with LSUS. They have a new program coming out called TechWise where they're going to bring students over from their different programs like IT, public health, and kind of work with our seniors. But exactly, and that's our thing is our seniors, a lot of them do have these smartphones now. Some of them still have other phones, but so Zeffy certainly allows us to use that QR code and let them link directly to how to make a contribution and stuff like that. So we're loving that platform. So, but no, it's not a requirement for them to pay for things like the meals and everything.
Gotcha.
Our meal cost right now is $9 a meal. And so we suggest that when they say, well, what should I give? We suggest $5 a meal. So it's still not our whole cost and everything.
Gotcha.
And not all of them are able to give that as well, and we understand and stuff. So that's the home delivered meal. And like I said, hopefully that other funding will come through. And if not, we are hopefully trying to get there. Because again, if we truly identify these clients in that highest need of homebound and everything, we do work with local churches. There is a church group that does Super Saturdays, that does a little thing on Saturdays and stuff, but I just really see the need of if they're at home, we should be feeding them 365. You know, we get the funding for 250 from our feds and our state level, but I really want to try to figure out how we can do this budget-wise and stuff. So that's the home delivered meal side. Then we have homemaker, like we said, that was kind of our starting thing way back in 1975 with some homemakers. And that service is designed for someone, again, who can't perform or doesn't have anybody to do that service for them. And it is to help them kind of maintain their home. Light housekeeping will help clean their bedroom, their bathroom, living room, kitchen. We don't clean up after pets. We're not climbing on the roof and cleaning gutters, you know, so just to kind of help them maintain. Now, we do get phone calls from apartments and stuff, and a lot of the apartments do know that we try to help with that, because they may be like, look, the situation is if we don't get this done, they're going to have to be evicted, you know, and that's hard because, one, a lot of apartments don't want to evict a senior because they're steady, you know, they're not going to go nowhere. Their income's stable, you know. These are good, solid residents. But if their home's not being maintained and in a safe condition, that's not good for any people in that complex, you know. So we do have sometimes where we'll get referrals like that, and the team will have to assess and decide, does the team want to go in and try to help? Sometimes we've done that, and then sadly it'll revert even with us going in and homemaker, just people's, I mean, mental health is real in seniors. It's not just a younger generation. We have seniors with mental health issues. So sometimes we have to go, we can't do this. You know, we can't keep putting someone in here when you're not doing your side, you know. So, but we outsource that with Elite. And so they send their homemakers in. They have to report back to us what they did. Did they do laundry? Did they do whatever? And another neat thing is with that service too, let's say this person doesn't drive. But, you know, during COVID, I think a lot of our seniors kind of got savvy to clickless shopping, and like, you know, now people do deliver, but, you know, that's usually a fee. Yeah. So if our clients have the homemaker, they can let their homemaker know, hey, I have a shopping order ready, and they can pick that up on their way or something. So that's kind of nice. But yeah, just the basic housekeeping and everything. Then we go into our caregiver service. And this is really where identifying those people who are helping take care of seniors. And one thing we have found, again, through COVID, is some of these seniors who were like, you know, I am independent, hear me roar, were like, somebody's helping me now, because they weren't going to the grocery store, they weren't doing things, and family was really stepping up with stuff, is we were able to identify a lot more caregivers with our seniors and educating the caregivers on what we can do and how we can support them. So in our caregiver programs, we have a couple of different facets. The first one is respite, where we can actually go in to give that caregiver a break. And I have two different little stories that really resonated with me. Is I had two gentlemen, they were both caregiving for their wives. They both had dementia. And this was back, we used to have dances every Thursday night at the council, and we'd pack it out, 60, 80 people. But this gentleman, he'd always come in, wife looked pristine, took her, get her hair done every Thursday, like she was ready to go. And one day he was just like, I'm so tired. I'm like, what's going on? And he was like, I just can't keep up with her, you know. He goes, I try to go fish, and, you know, I can't leave her at home anymore. So I took her out in the boat with me, and she's making too much noise. I thought she was going to fall in the lake. And it was just so crazy today, because, like, he was just trying to get a little reprieve, you know. Yeah. And he's like, I'm just exhausted, you know. And then I had to get her back up to the shore, and he's like, I just don't know what to do. And I was like, why don't you let us come give you some caregiver respite? He goes, what does that mean? And I said, we'll be there for a couple of hours. You can go fish. And he was like, what? And so we were able to get in there and help support them for a little while. And then eventually we did have to, like, bring her family in and say, look, it's getting harder, because we could tell he wasn't even able to do some things around the house, and it was just getting harder and harder for him. And then another one was, we had some clients in Benton, and similar story, he was taking care of her, and they were married 75 years. Man. Yeah. And so they would come up to the senior center, and it was almost like, I don't know, like he was like, here she is, I'm done, you know. And literally she was so active, because that's the kind of thing with dementia, you know, being a certified dementia practitioner, there's so many facets within dementia. But oftentimes it doesn't affect them physically, you know. And this lady literally danced the former mayor of Benton out of his boots one day, because we had like a guy there playing the guitar, and she was just dancing with him. He was like, I got to take my boots off for this. But I went to hug him one day, and as I hugged him, she walked by me, but I hugged him, and I kind of smelled an odor. And I said, hey, is she not letting you give her a bath? Because that's very common with dementia too. They don't want to take a bath. In their mind, they already took a bath, or it's not time, or whatever. And so he goes, why, did you smell something? I said, yeah. I said, we can help with that, because we were going and giving caregiver for them. I said, we can give her a bath while we're there. He said, it's me. And I went, what? I'm going to cry. And he said, 2 weeks ago, I will bring her in the bathroom and I'll tell her, sit here while I take a bath. And he said, and I talked to her, almost like me. I have a special needs son. I used to do that with him. And he said, so she didn't answer. So I stuck my head out and she wasn't there. So he said, so I jump out of the shower and she's not in the house. He says, then I'm like getting dressed and she's down the golf course. And he said, so I haven't taken a shower since then.
Dang.
And I was like, oh my gosh, okay. So from now on, because we were going once a week back then, I said, when we come, you take a shower. Because he was just so tired, he would just go lay down. He would just have a couple hours where he could just lay down. I was like, you take a shower first. And that was definitely another instance too, where we called the family and we're like, hey, did y'all know? And this was a family who talked to them. He has a bunch of kids. They all talked to them every day. But he told them we were coming every day, not just once a week.
Yeah, he just didn't want to burden them. Yeah.
So the caregiver respite, that to me really helps relieve that caregiver and stuff. I talked to a lady just recently. She's being transferred up here with Barksdale from down in Florida and bringing her mom with her. And she's like, I need to know what kind of support y'all have. And they're moving to just outside of Bossier City. So I was like, well, unfortunately, we can't pick up, but y'all could bring her here. And I said, but we do offer medical. We offer this, we offer that. And then when I told her about the caregiver, I can't say she started crying, but I just get to hear it in her voice. And she's like, okay. She said, I'm just going to say this. I was dreading coming up there. Like, I'm military. I got 4 more years. I'm going to do what I got to do. But thank you. Because, if we can get into that, I can do my job now. And I was like, well, welcome to Bossier, Get connected. There's other things, like the chamber has great military support and stuff. So our caregiver really is a true blessing to so many people. Then the neat thing that a lot of people don't realize, you mentioned didn't even realize we were back there. We take donations of medical supplies. Now we can't take beds, big stuff, but we get incontinence supplies like the diapers, the pull-ups, the wipes, bed pads, things like that, and we give those away for free to our clients. And we have a lot of families that, nutritional drinks like the Ensure, the Boost, the protein stuff, they will call us once a month, every month, can I get my supplies now? Can I get my supplies now? Because that's, $20 they don't have to buy and stuff. So, and we deliver. We have a wellness assistant that she'll deliver all throughout the parish. So she just she gathers everything up, and people, can't come pick it up. We go deliver it right to them. So that caregiver supply is a real perk of having that caregiver support. So that's pretty much all of the real services in a nutshell. I tell people all the time though, you may come to the senior center to exercise and not realize you're getting this other lanyap that may happen that day and stuff, because there truly is just all kinds of little things that come in it and everything. So
that's a lot.
It is.
And it's a lot and it's something I think people need to know about. You have this offer that you can do this, and it's of no cost to them. It's just encouraged that they can contribute somehow, and especially for people, because I just feel like, I know I'm not in that, window, but I mean, everyone has someone related to them that could qualify, I would think.
All came from somebody.
Right, exactly. So fortunately, my grandmother, she's still getting around great. She's 86, I believe.
She should come to the senior center.
Yeah, just come hang out. Yeah,
we do yoga. They do chair exercise. They do, all kinds of stuff. Yeah.
So this is something for people to come and network, and not only just if they're having some type of ailment, but actually
the senior centers are more like a rec center.
Right.
They're to come, hang out, fellowship.
Got you.
We have an herb garden. Our seniors are starting to get into doing herb stuff and everything. I have one guy, he just kind of comes, hangs out, and he feeds the cats every day. That's kind of his job. We have some feral cats that hang around. So, but he gets out of his house. Yeah. He is getting out of his house.
Well, that's the biggest thing that people don't understand. The decline starts when you quit moving. Right.
Absolutely. That especially, as you're exercising. Health regime.
It's just one of those things. I mean, you get more illnesses, you start eating worse, you don't exercise anymore, then it goes to, just complete. Then the body starts internally having issues.
Muscles atrophy.
And then the dementia thing is interesting though. So like, tell me, since we were kind of well versed in dealing with that stuff, like what are some of the first signs of it? Well, people, that you've seen.
People always joke, oh, I lost my keys, I have dementia. Well, that's not necessarily it. But one of the things that I find, if I go in a client's home, and I've told families this, and I'm a sticky note person too, so, it's not 100% like this, because like my thing is don't forget to pick up the medicine at the store, that kind of thing. But if you go in someone's home and like there are notes everywhere for everything, they're forgetting something. So
that's common?
With dementia.
Really?
Yeah. Because, and again, I'm not talking about like little thing like, oh, don't forget to pick up the meds.
You're talking about like the plates are in this cabinet, something like that. Or like my
grandmother was like, turn off the light switch. These kind of things.
Got you.
Then one time when I went to her home, her note on her mirror, teeth are in the cup by the sink. And then what was kind of a little funny, but even worse, that note was in the kitchen. Because she would get to the kitchen to eat and doesn't know have her teeth in, and she didn't know where she had her teeth. So that note was in the kitchen. So teeth are in the cup by the sink.
So that's the early stages. So they're realizing they're forgetting stuff and they're leaving reminders.
They're trying to compensate. They're trying to compensate. Yeah. And then dementia is really like almost like a spiral because, eventually if someone lives long with dementia, because people don't really die of dementia. They die of other stuff, but as they spiral, the memories they're going to remember aren't going to be the ones that just happened. Like I just talked to somebody this morning. It's going to be that long term, which is sometimes you'll notice too. They may tell you the stories, but they're always stories from a long ago.
Gotcha.
And stuff. It's not going to be a story about what happened last weekend. It's a story about what happened 10 years ago or something, Then the other thing too, are they asking a lot of questions about current things, Are we going to go to church Sunday? We're going to church Sunday. We're going to go to church Sunday, or different things. Like they're asking a lot of things about the most current, coming up or past things, because they're trying to keep that fresh and remind themselves about it and everything. So my son has autism as part of one of his special needs. And I obviously was in gerontology school, was doing all this stuff when I had him, and we didn't have a diagnosis of autism until many years later. And as I started looking at it, and I was like, golly, like dementia and Alzheimer's, because there's so many types of dementia. It's not just Alzheimer's. There's Lewy body, there's Parkinson's with dementia, there's all kinds of stuff. But when I looked at the behaviors that my son was having with autism, and then some of these behaviors with my seniors with dementia, I was like, wow, they're kind of connected. So it was kind of wild.
Yeah, it is. That's interesting. I'd like to know, Josh, can you see what the statistics are on dementia over the age of 60? How many percent of people are diagnosed? Which is probably a lot of undiagnosed too, right?
Oh, correct. Yeah. So
people that aren't telling anyone, or
yeah. And that's the other thing too is sometimes, because again, people don't necessarily die of dementia, so they may have had dementia but died of something else and never really went diagnosed. Maybe there was just little indicators and stuff. But like Ronald Reagan, so one way that he was able to get diagnosed so early was because as a president, he was having brain scans, and they saw the shrinkage of his brain before he ever started showing symptoms.
Gotcha. Okay.
Because our brain ages naturally, and you were talking about like muscle and working out, stuff like that. So the brain's a muscle, but it atrophies with age. Okay, there's not really a whole lot you can do about that. It's going to have just natural. But when you have dementia and Alzheimer's, there's a more significant shrinkage that happens.
Gotcha.
But you only see that if and not all of us are getting MRIs and CAT scans every 6 months like the president.
Right.
That's how he was diagnosed.
Yeah, you're not going to get one of those until you have an issue.
Yeah.
So 5 to 8% over 65. And this number doubles every 5 years after that. So we go to 70 years old, we're talking about 16% of people. Yeah. We go to 75, we're talking about what? 32%.
13, around 13%.
Yeah, so like. Yeah.
85 over 33%, yeah. And that's the thing,
that's
too.
That's crazy. 85 and older, 33 to 50%. So like, that's a lot. That's a lot. That's crazy.
And one thing, too, you'll hear a lot when people talk about like dementia, and of course, again, going back to you and you're very healthy and your workout regime. If you don't work out, what's going to happen to your muscle?
They're gonna shrink.
You're gonna lose it.
Yeah.
Same thing with your brain. Like I said, we're not going to build our brain. Our brain's not going to get bigger.
Right.
But you use it or lose it, and that's going to come from interaction with people, doing things that are active with your brain. So that's part of what coming to a senior center does.
Yeah.
You're socializing. We do, like I said, we do all kinds of fun stuff. One of the newest fun things we're doing is we do music trivia. I know Bayou Axe right over here below us does music trivia, and I came by one night and I was like, we're doing this at the Council on Aging. And it's just fun because it's so weird. Like, we could probably forget a phone number, but you play a music like, ding, da, da, ding, da, da, ding, ding. You're going to think Ice Ice Baby or Pressure, but our seniors are the same way. You start playing a couple of songs and they know it, So those things, you're connecting synapses in that brain and going toot, 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 and getting those little neurons firing and stuff.
Yeah, I mean, that's that's really anything that could keep you, whether it's, brain activity going, lung capacity for moving, digestive by moving,
Correct.
Getting up, moving around.
Correct.
All that stuff that's important. People chase the retirement age to sit still, and then as soon as you start sitting still, everything starts falling apart.
That's true.
I mean, naturally you're going to have issues along the way, but I mean that's just one of those things that I've seen it in loved ones and people, and people close to me. It's just like as soon as that happens, man, it's just
And you mentioned retirement. I want to say this because some people think, well, I'm not going to go to the Council on Aging. That's just a bunch of people in wheelchairs and this and that. We have some clients that are in wheelchairs. We have clients in walkers and stuff. I have some very active clients that have retired, and they're my best volunteers. They are amazing.
That's
like, we
thing.
wouldn't be able to do what we do because, I mean, my staff is paid, okay? Once somebody asked me that one day, they said, why do y'all need offices? Aren't y'all all volunteers? I'm like, we could not do this. Because we talked about numbers earlier, and we're doing about 140 meals for home delivered. But overall, we're touching about 1,800 seniors in Bossier Parish a year. So that means at least one time, whether it's a fan we gave out, they come to the senior center, whatever, there's about 1,800 seniors in Bossier Parish. That's gone up, though, because that was during the year of COVID. I'm pulling the year of 2020, so that's gone up. So before COVID, it was about 2,400. So I bet we're probably getting back to that number now. So, but yeah, our volunteers really help us do all that. I mean, they're out there helping put together arts and crafts projects. They're helping put together our calendars because the site managers, like, they're having to do the behind the scenes, get the assessments done, that kind of stuff. So our volunteers, you're retired, come hang out. I'm not trying to make you go to work, but a lot of them kind of find out that, like, I don't want to just sit around. Like, I want to do a little something, and have fun.
Yeah. What about, I was thinking about something about dementia and I lost. Oh, the sundowns thing.
Sundowning, yeah.
That's like super common, right?
It is a common behavior. It's not like meaning, if you have dementia, you're going to sundown, but it is an aspect that happens. And basically that is in the afternoons because we know the moon affects the tides and all these things like that. And, summer, the days go longer and stuff. But when the sun starts to set, it just kind of triggers some anxiety in some of the people with dementia. It could be things like pacing. They could get aggressive. There's all kinds of different ways. And when I meet with people one-on-one, and even when I run my nursing home, is not, again, every resident had it, but we had a few, and it was like, figure out how we can help them through it. If it was somebody who wanted to pace or whatever, we're like, let's go out and walk the garden,
Gotcha.
That kind of thing. And I often tell families, sometimes there's people with dementia and it's just stressful, but then there's some that they're just pleasantly confused. And there used to be a train of thought for a long time about, we have to orient them. Well, they have to know it's 2025. They have to know this. But I told families, sometimes that's more of a stress for that person.
Yeah, if they're confused and they don't know what's going on anyways, and then you add that into,
Yeah. And like I told my aunt one time, my grandmother had Parkinson's with dementia. And I didn't realize my aunt was doing this. Her intention was pure. On the way to the doctor, I'm riding with him one time. I was over here for the weekend for grad school, and she was going to see a well-known doctor over at LSU, Dr. Swag. He was real good in Parkinson's. And she's like, okay, Mom, pencil, world, and like the day. And I was like, what are y'all doing? She said, he's going to ask her these questions. And like it was basically she was preparing her for the test,
which is not giving an accurate assessment.
Exactly.
Right.
And that's what I told her. I said, no, ma'am.
He needs
do
an
not
accurate
do
assessment.
that.
Yeah.
You're skewing his ability.
And you're cheating her too out of proper treatment, right?
Exactly.
Yeah.
And my aunt just thought it was, well, I just want her to be okay. And
Dude,
I'm like,
I bet a lot of loved ones do that for family members.
Yeah.
I mean, not trying to hurt them, but
they think they're helping. Yeah.
Right. That's probably not the best solution.
And then here was my aunt too. I'm going to point because she had the pencil. And so she sat behind Dr. Zwag. And I'm looking at her and I said, whoa, stop. I said, you leave the room. I said, now ask my grandma. And he just looked at me. And I mean, at this point, I'm a 23-year-old nothing, you know. I mean, I'm in grad school. And he goes, why? What changed? And I said, my aunt's been cueing her for years. And he just went, what? But what was so odd is he told me, he's like, I never thought about that. So he said now he stands behind the family and like where he can see both of them.
Yeah.
Or, I mean, I don't know if he's still in practice now, but he said and a lot of families were doing it. So yeah, it's like you're not doing them any good. You know, it's kind of like my son with autism. I want the doctor to see what is truly going on so we can provide the right therapies, the right supports, whatever it may be.
And how old is he?
He's 23 now.
And is he living with you? And
He lives with me. He works for the Mudbug hockey team as an usher, and he's super active. He goes to a therapeutic recreation program over in Shreveport. I wish Bossier had a therapeutic recreation program. It is amazing. And he's excited, though, because he was just gifted through Low Key Boat Sale. They're a local nonprofit, or a new nonprofit here in this area. They support families with vacations.
Which one is it?
Low Key Boat Sale.
I met them.
JD and Courtney.
I met another lady that was helping them who has a child that is going through the same thing. I can't remember her name right now, but I did meet. I met that organization. Yeah.
So he's excited because
cool.
They gave him and another young man from Mudbugs, Coach Chris. They were the first recipients, and they're going to Key West this summer.
That's awesome.
So Daniel's like, I'm going to swim. I'm going to go. Yeah, he's excited. So
That's awesome.
So he lives with me. He functions pretty well. He has muscular dystrophy, autism, and scoliosis, and some developmental stuff. But yeah, he's a go-getter.
Do you think helping him and raising him every day is completely just made you more aware and active in this space you're in? You think that has a lot to do with it? Or
I can tell you in all honesty, one, like I said, at 17, that first day in that nursing home, I knew I wanted to work with elderly.
Mm-hmm.
And then when God blessed us with Daniel, because he was diagnosed at 9 months old with muscular dystrophy, and then when he went into Bossier schools at 3, the teacher said, I think he has autism. And I was like, no, baby, you need to read his notes. He has muscular dystrophy. And they're like, I think he has autism. I'm like, whoa. And thankfully, I listened to that, and I didn't just go, no.
Yeah.
I started going, well, maybe. And that's when I also started going, well, look at my dementia. And I was like, there's some similarities. But I thought I knew a lot, and I was humbled to realize I didn't hardly know nothing about the disabled community. I know seniors. There's a lot of connection. And as his disability, I'm not going to say grew or got worse, but as he got older and I got more involved with things with disability, I realized in our state, and not just our nation, but here in Louisiana, we have such a disconnect. We have seniors, disabled, veterans. And in all honesty, we have those 3 groups that have a lot of similarity in needs. And
there's probably a lot of overlap of it.
We could.
Like funding and budget and
there's
organizations.
not overlap. That's what we should do.
It needs to, though. Because you have organizations that can serve both.
All three.
All 3, yeah.
You know, if you have a veteran who needs to get a ride and they're in a wheelchair, where can we get that?
Yeah.
You know? But right now we're in a silo of seniors, a silo of disabled community, a silo of veterans. And if we could really start to merge and just go, hey, we can play together. But it's just so weird. People think, well, no, I can't. This is my money. But it's like, but look, we could mesh. We could support together, you know.
Right.
So that's what's opened my eyes a little bit. Wanting to support him and living independently is the same as I do want for our seniors, which is kind of where when my aunts were really pushing me, they were like, you have been fighting for Daniel to be able to live independently when he gets older. And yet that's what the Council on Aging does. So when I really looked into the council, back in 2010 and what they did. Because when I was when I was working in Caddo, we just helped deliver meals. I didn't realize what all else they did.
Right.
And stuff, which is the thing so many people say. Like when people find us back here off Bearcat behind East Bank, I didn't know y'all were back here. And then they look in the building, they're like, oh my gosh, this is so huge. Oh wow, y'all do all of this. I think when you came in and you saw the exercise equipment, and it was like, dang, this is cool. Amazing.
Yeah.
This nice Kaiser equipment, and our Elvis, our little vibrating tectonic plate machine, But it really did start to merge at that point, because what we're doing is trying to keep seniors independent, and that's what I want for him too. So.
Got you. Well, before we wrap up, let's talk about the couple things you have coming up. This will launch before your first event and also your second one. So if you want to plug those and kind of talk about them a little bit.
Yeah. So May is Older Americans Month nationally. That is through the Administration of Community Living. This year's theme is Flip the Script. So we always try to honor Older Americans Month, and we do a fish fry. So we do a fish fry and a health fair. We've got 10, 11, 12, 13 vendors for the health fair, and that is going to be Friday, May 16th. We normally do it the Friday Memorial Day, but we have the wonderful City Marshal Jim Whitman and his bride, Miss Vicky, with Vicky's Fresh to Go. They're cooking for us, so we had to work with their schedule, because Jim's got some work commitments, and we want to let him be able to serve the community, So we're going to do Friday, May 16th, and again, it's right here at 706 Bearcat, right behind East Bank. And our building basically faces the football stadium. So when people think about it, they think we're part of the school, because we look like it. We're in that same color brick and everything, but we are independent. And that's going to be from 9 to 12. Tickets are only $10, man. I mean, you're going to get fish, fries, hush puppies, a dessert, a drink for $10. So we have to-goes available. They can pick up. We will deliver if it's orders of 10 or more in Bossier City. And then, of course, the health fair, and those vendors always have lots of goodies and good information, too. And it's not going to be the same thing. We're not going to have, like, 6 home healths. We have the sheriff's office. Like, we have one of kind of each independent thing going on. So you're definitely going to get different people you can talk to and stuff. So that's the 16th from 9 to 12. Definitely want to encourage people, though, to get their tickets. And I know y'all are probably going to post the link, but they can go to our Facebook. I want to thank Red Wolf. Y'all are really helping promote that for us and everything, making it super easy for people to find the event. They can buy their tickets right there via Zeffy. We can take cash if people want to do that. We're selling tickets in person with cash and everything, but we have a limited number available, so I would encourage them to get that so they know they have a plate and everything. And also, a purchase of a ticket, fish plate, gets them in a door prize.
Oh, there you go.
We've got lots of good door prizes. They can find all those on Facebook, local vendors, tops, different ones. So they can get a little happy before the weekend, before Memorial Day. Then our big one, like we said at the beginning, is June 16th marks our 50 years of serving Bossier Parish. So we have an open house event planned. We've got a couple of food trucks. I know you want to say the names of those food trucks?
Yes, El Eden and Caltex are going to be there. And then you have a little car show.
We have a car show, but we also have streetcar snowballs.
Streetcar snowballs, yeah. Sorry, I was thinking
snowballs.
Food. That's the dessert, yeah. And
then the car show. And tell me what kind of cars we're going to have.
So we don't have those exactly pinpointed yet, but I will tell you that Fondren's Classic's coming through, and so he's going to get us the closest thing. We want some 1975 models, right?
Yeah, we were thinking we wanted 1975s because that's the year we were.
And I know he has at least one, but we'll have a couple that he's going to bring over, so we can they're all going to be pristine. Everything he has is pristine. Either he's restoring stuff or he's built them and selling them for people. So
sweet.
So we'll have a cool couple. And I'm excited because I was like, hey, dude, I'm going to drive something up there. So we have the car show. Bossier Chamber's going to do a ribbon cutting for us, marking that 50 years. Sonia Bell's going to MC the event. So when people come through, they can take a tour, find out a little bit more about us. Maybe they know someone that needs to get connected to us. They just want to find out. We are always looking for board members and advisory council. In order to serve on the board, you have to live in the parish. The advisory council, you just have to have an interest. Maybe you have a business, but you live somewhere else. But this is a great opportunity. Maybe you want to find out how to serve. And so you can come by, take a tour. Again, like I said, the ribbon cutting. And then if you take a tour, you're going to get a ticket to have a meal at the food truck, and everybody gets a streetcar snowball that day. Yeah.
What is it? Is it a snowball?
Yeah, I think so. Yeah, snowball. Yeah.
Okay. Yeah. I know it's not a snow cone. It's street ball. Yeah.
Yeah, because it's in a little cup, I believe.
That's right. Yeah.
Yeah.
She's great over there.
Well, awesome. Well, any other things that you want to mention or plug before we close out here?
Yes. So this is a question I keep getting, is because we are, like I said, quasi-governmental. So
Right.
of course we get federal money, state money. In Bossier, we are very supported by the Bossier Parish Police Jury and also Bossier City. And the building we're in over here on Bearcat is a Bossier City building. So people that follow everything that goes on knows that Bossier City allocated $4 million for us to get a new building, or get a better building. Doesn't have to be new. But I get asked that a lot. Well, I thought y'all had $4 million. What are you doing? When are we doing this? Because our building is older. It's been there since the 50s. And so my aunt actually used to check toys out of my office. That's how old that building is. But we are working with the city. The mayor, he's told our board and our advisory that he has an idea of a possible location. Our board has been looking at some locations as well. And it is a process. It's not just, oh, this is what we want. It's going to happen. $4 million isn't possibly all we need. The architect has done a square footage analysis of what we use in our building, because our building has been added on multiple times. But in looking at what we need about 16,000 square feet. Like I said, we need offices. We have to do our work. We have to make reports and tell everybody what we're doing with the money we get. But the main thing is we have that senior center and the functionality for what the seniors need to have. So really making sure the building fits both those needs. And when I first started going to the city to talk about it, it was like accessibility. And to me, accessibility doesn't just mean a wheelchair can get out of our building. But that is true, because we have certain areas of our building that wheelchairs can't access. If I have a client that needs a caregiver in a wheelchair, they can't even get in some of the areas to take them to the bathroom and stuff. But accessibility also means technology accessibility. The location of it. We love this location.
Right.
We're kind of hidden, but we love Central Bossier. Like we don't feel we need to be going. If we went north, we would need a second one for south, and vice versa. So we love Central Bossier. We want to be easily accessible for people to get to all around, and plus for us to then serve, because we do pick up and hub out all across the city and everything. So accessibility is more than just I can get through a door.
Right.
It's a lot of things. So all those things are being taken into consideration. So we'll definitely be taking this little piece of your podcast and using this as when people ask with that $4 million. We're working with the city. We know we have that $4 million. There may need to be more, because realistically it may cost up to $7 million for the 16,000 square feet that we need. We have $1 million of our own. However, we know that we're going to be responsible for doing some things with the new building, whether we're going to be responsible for the maintenance after this or whatever. So we are truly trying to find and get the best ability to have the building 100% covered without tapping into our $1 million. And that way we can keep it as a reserve for whatever may come down the road and everything.
Right. Well, that's good news. I mean, there's a light at the end of the tunnel,
There is. This has been being discussed since 2007. That was when I went back in notes and minutes and everything. So Mayor Walker and the former director before me, Miss Rankin, in 2007 started discussing the need for a better facility for Bossier City. So we're almost 20 years.
Yeah, it's time to do something.
We got to get it done.
It's time to do something.
Yeah.
Well, I hope this brings some attention to that for sure. I wasn't aware of that. We talked about it a little bit, but I wasn't aware of all that. But yeah, I mean, I'm excited. I'm excited to be involved, and I'm excited just to know that you guys exist, how you operate, and also let everyone else know,
Yeah.
So.
And anybody listening, like I said, if you want to serve on the board, serve on the advisory, if you have a referral to make, you can do all of that through our website, bossiercoa.org. You can make a referral, apply for board or advisory.
Awesome. Well, great talking to you today.
Thanks so much.
Yes, ma'am.